So this is going to be the second video where I will tackle another issue, why some group are more likely to have COVID than others. I didn't get it, it's we know the statistic in the US. Let's do it this way. We know in the US, UK, then Canada, when they run the statistic, black people are more likely to have COVID than as a community. Why? I never get it. It does not make sense. Like here we have black people less infected with COVID. We know that. This is the output, right? We know this is when they test, it show here we have very low, 20 times less. But when you are black, you live here, or Canada or US, you're most likely to have COVID than other people. I never get it until I watch this video. Then let's go check this one here. I never get it until I watch this one.
A block party for our times. In Toronto's COVID hot zone, where black people are the largest population group and infection rates are high, people are encouraged to come out of their apartments to get tested.
It decreases that anxiety. It helps people feel comfortable.
There's good reason to be anxious. Data from the US show visible minorities are more likely to test positive for COVID-19 than white Americans. No such research is available for Canada, so visible minorities don't know their risk level. But data from Toronto Public Health is revealing. Less than 10% of Toronto identifies as black, yet they represent 22% of cases, while whites, who make up almost half the city, account for 17% of cases.
What is less clear in the Canadian context is why.
This infectious disease doctor plans to find out with widespread antibody blood testing in Ontario's black communities to learn who's already been exposed to the virus and discover who's most susceptible.
And how measures ought to be ramped up or directed at minimizing the risk of further outbreaks within certain communities based on the risk factors that we identify.
But finding black volunteers to give blood for science could be difficult. So says this local leader. There are several...
So I'm just going to stop it here. And when I watch this video, you know what I find out? It's this image. This is where I get it. When I look at this building behind, I said, yes, it makes sense. They can even locate them. Let's see. What happened is, it's unbelievable. It's like I said, we are the hosts. Any explanation has to be simple, right? You don't need to be a scientist. You don't need to be smart, and even don't try to be smart, because you don't need it. It's simple. I never get it, right? It doesn't make sense. It's easy. This is a workplace. This is a store. This is a public area. People, it's very difficult to have in this kind of environment. Let's say the workplace, you have a manager and a cleaner. They're all going to be in the same environment. They're going to touch the same door, It's very difficult in this environment to differentiate. This is a store. You have rich or poor people, whatever you have. White and black and Asian, we mix here and we do our shopping. Workplace, same thing. And until I see that video, I said, no, the difference is when we go home. Going home to a house is different to going home to an apartment building. Completely different. Yes, it's not the same. We human, we have just two types of habitat. A horizontal habitat here, habitat where we have houses next to houses, right? And a vertical habitat. So in the vertical habitat, we basically stacking these houses vertically, and let's say you have 400 houses, you're going to have 400 doors. Here you have 400 houses, we call them apartment, you're going to have one door entry, one main door entry. So we're changing the number of door from a big number, let's say number of houses equal number of door. Here, number of houses, whatever number of apartment, like the building we see, it just, let's say, one door entry, to make it simple. It's not the same. Let's say you have a couple. Let's say each apartment has one adult. So you're going to have here a community of 800 people, right? And here you're going to have another community of 800, right? And you have one in this first house, you have one infected here, one infected with COVID. So this one adult will able to infect just one adult. And we know, right, when you have the virus between the 48 and 72 hours, when you get infected, that's where you become like very, very bad. Like you can transmit very bad, because in biology, we know that the virus going to try to be viral, right? So when it gets into your system, the first thing he makes sure you pass it to another person. This 48, let's say it's 2 to 3 days. What will happen? This adult here in the house, he go to work, right? He touch the door, he go. He can infect the adult. He came to work, he touched the door. So in the day, he gonna be two chance. He has two chance